My mom, she's not in my life, and she really never talked to me about nothing like that, and she really didn't show me how to be a mother, so it was hard for me when I became a mother. I was like,
18-year-old ADRIANA Gonzalez got pregnant with her first child at 15, her second at 17. With no job, no husband, and a limited support system, the young student has relied heavily on state services to care for herself and for her children.
Medicaid is a big one, and food stamps, because we usually run out of food pretty quick where I live. My son right now, he has like WIC, so he gets the formula and baby food and oatmeal, baby oatmeal, so he's good with that for right now.
Gonzalez's case is far from uncommon. In San Antonio, where she lives, health officials report nearly half of teenagers are sexually active. Last year, nearly 3,000 girls 19 and under gave birth in Bexar County, and teen childbearing cost taxpayers there $64 million. Though national and local teen pregnancy rates have fallen steadily over the years, Texas still ranks 4th highest in the nation. A 2009 state survey showed 47% of pregnancies in Texas were unintended and occurred more often among poor, unmarried, Medicaid-eligible women. That may help explain why in 2010, Medicaid paid for 56.9% of all births statewide at a cost to taxpayers of $2.2 billion. What's often lost in the politicized battle over family planning is what it means not to help people plan their pregnancies, both for communities and for state coffers.
Oh, he's fluffy.
When we met ADRIANA Gonzalez, she was with 5 of her fellow teen moms. They adore their children, but admit they are struggling to make ends meet. Most had unplanned pregnancies, the result, they said, of a lack of sex education and birth control. All 6 delivered babies covered by Medicaid.
Like in school, did you learn at all about how this works?
No. Not at school. I didn't have help in school until after my pregnancy.
Yeah, it's like they start showing you everything after you have a baby. Like,
yeah, they show you basically when you're pregnant, like the 9 months, you know, and then the baby coming out, but that doesn't help. I mean,
you're already pregnant.
Yeah.
You've had these kids. Have you had to rely on some help?
a lot.
SARA ALCANTARA was just 14 when she got pregnant. She's heading to college in the fall, but says she could not have made it this far as a single mother without public assistance.
It's Medicaid, because with Medicaid I get help. CHIP, that works too. I don't have to worry about paying bills when an emergency visit. Medicaid pays for that. And then for my own health too, I still get CHIP. I could get my dental, my glasses. It may seem like it's not a lot of help, but to me it is, because it's hard. I will earn $7.35 an hour, and I mean, it's a job, but it's not enough.
Though most of these moms are fearful of getting pregnant again, they're also still girls growing up, balancing school, work, kids, and the pressures of young, turbulent love. ADRIANA says the father of her children is in and out of prison.
I mean, I really didn't want to have another baby. It was just like, oh, well, you don't love me then, or you don't want to be with me because you don't have my kids. And it's just like, I don't want to lose you, but I don't want to have a baby either.
The consequences of Texas's unintended pregnancies are obvious. Dependence on food stamps has steadily grown, as has the rate of clients receiving nutritional supplements from the Women, Infants, and Children program, known as WIC. The vast majority of the state's Medicaid beneficiaries today are kids, some of them born to ill-prepared parents.
We have a large statistical population of children who are abused and neglected and removed from their homes.
Annette Rodriguez is the president and CEO of the Children's Shelter in San Antonio, an emergency home for nearly 700 abused kids every year. She said they've been at capacity for months, the result of rising child removals, spurred by everything from severe violence to neglect and starvation.
It takes them a while to realize that, you know, they're going to get their 3 consistent meals and their snacks so that they don't have to hoard food.
We cannot show you these kids' faces because they are currently wards of the state. Rodriguez said in her experience, most parents don't reclaim their children, and foster homes are in short supply.
If children are removed from their homes, they moved into the child welfare system. Essentially, the state of Texas is now their parent, and we need to provide services for those children, and it's much more costly for the state of Texas to take care of children than it is for their parents to take care of their own children.
Rodriguez says preventing tragedies and major costs starts with improving access to family planning.
Certainly, if women don't have access to health care and preventative health care, then what ends up happening is we see those stress levels, whether they get pregnant again and they're adding to their family, they may not have the ability to provide for the new child coming into their lives. So you see frustration levels go up, you see stress levels go up, and that then becomes a recipe for abuse and neglect.
It's so political, it's so charged.
Physician Janet Riolini is president of the Healthy Futures of Texas Coalition, which is working with the Children's Shelter and others to prevent unplanned pregnancies. She says access to birth control and women's health services has receded since the state's decision last legislative session to reduce family planning funding by roughly 2/3, or $73 million.
Well, this cut has really devastated the fragile infrastructure that serves low-income women around the state. There are communities that have other resources that thankfully hospital districts and federally qualified health centers, that's great. But that doesn't reach near what our safety net has been reaching.
Abortion opponents have praised the funding reduction as a means of defunding clinics like Planned Parenthood. But state health subsidies have never paid for abortions, and the budget cut hit all health providers statewide, including the San Antonio-based safety net University Health System and its 16 clinics.
We do not perform abortions in this health system at all. And in fact, it's a requirement of this health system to notify the state that we do not perform abortions in order to receive the family planning funding.
But you still lost the money just the same?
Just the same, yes.
THERESA de la HAYA is a nurse and the senior vice president for the system's community health and clinical preventive services.
We were getting over $2 million and providing services to over 10,000 unduplicated patients in our health system throughout all of our clinics. We've had to reduce that to close to about 2,300 unduplicated patients. So we've lost about 75% of our patient base.
In the state capitol, politicians on both sides of the aisle are preparing for an upcoming legislative session that's likely to face another budget shortfall. State Representative Garnet Coleman, a Houston Democrat and longtime advocate of women's health services, says abortion foes, especially religious groups that also oppose birth control, have extended their war to include preventive services. He says it's unclear whether their influence can be dialed back.
And this is new. This is definitely new. And it's disturbing because, again, it's penny wise and pound foolish. It's sure to mean more Medicaid births in Texas and more money spent by the state.
Republican Senator Bob Deuel of Greenville opposes abortion, but he is also a family physician who shares a middle ground with Democrats when it comes to providing birth control to those who can't afford it.
Some people think government shouldn't provide it. And I look at that as, well, perhaps not, but let's look what happens if we don't, which means more pregnancies that are unwanted, which would lead to more abortions. It will lead to more kids on welfare. It will lead to higher education costs. Just because you don't provide the care doesn't mean that those people won't keep having sex and keep having babies.
But Deuel is convinced that with more personal responsibility and increased charity from private doctors, women can still get the services they need, even if it means they have to travel further or pay more out of pocket.
3 or 4 office visits a year, an exam, lab, all of that can be done for $400 or $500, which is a lot of money, but in the scheme of things, if you talk to various advocates for lower income people, they think it's fair for those folks to spend about 5% of their income on health care.
Back in San Antonio, Riolini says those costs are prohibitive for poor women and that she's worried they may skip getting care altogether.
I think the bottom line is that unplanned pregnancy is something that has ripple effects throughout the family, throughout the community. It's not that we don't love the children. It's not that we don't want the children. We want them. It's just how do we help them be as healthy as possible? We start in a healthy way.
Okay. Here we go. For a lucky few poor pregnant women, that healthy start comes in the form of home visits from registered nurses like Nancy Velasquez.
We are social worker, nurse, case manager, counselor, you name it.
She works with the Nurse Family Partnership, a program that helps low-income first-time mothers understand pregnancy and parenthood.
So that could be the sign right there going into the stages of early labor.
Today, she's meeting with Desiree, a 16-year-old who was 37 weeks pregnant with her first baby.
What you've been experiencing is a Braxton Hicks, very normal. Anything else?
Just that pain right there on the side.
Okay.
Unlike family planning funding, the nurse-family partnership emerged from last year's budget cuts relatively intact.
Length, 19 to 21 inches. You're there.
This means Velasquez can guide Desiree through the first 2 years of her baby's life, with the hope that the teenager will eventually be self-sufficient enough to raise a child on her own without the government's help.
With Leticia before the next visit.
High five. Yes, you did it.
Reporting in San Antonio, this is Ton Tan with the Texas Tribune.